Good evening, you're with Channel I and this is iMed. Now, in your childhood you might have come across various types of systems, or when you were learning you might come across various types of systems in the human body, say for example the blood circulatory system or the respiratory system or the reproductive system. So today on iMed we're going to touch on a topic which is sometimes considered to be as a taboo subject, especially in the Sri Lankan community. And without any suspense, I will reveal you what we're going to talk about, and it will be about STDs or STIs known among the community. Well, STDs, as you know, is a sexually transmitted disease. And to talk in a more deep manner about this topic, we do have with us an expert of the subject. We do have with us the consultant venereologist at the Sexual Health Clinic in Kalutara, Dr. Lasanthi Sirivardhana, here with us. A very good evening to you, Doctor, and welcome aboard the show.
Good evening.
And pleasure is ours, Doctor, having you here with regard, in midst your busy schedule. And to get on with the conversation, my first inquiry to you would be, now basically when we talk about STIs, it's important for the general public to know what is an STI from an expert's point of view. So if you could define what is an STI.
Yeah, sexually transmitted infection is an infection that is predominantly transmitted through unprotected sex. However, sometimes these infections can be transmitted through an infected mother to a baby in the uterus or during partus or through breast milk as well. And also sometimes these infections can be transmitted from infected blood or blood products during unsterile procedures like injecting drug users using unsterile equipment. So that is what we can define as sexually transmitted infections.
Okay, now when we actually talk about STIs, STI is not a specific disease, it's a range of diseases. So if you could explain the most common symptoms when it comes to when you treat to what do you see in patients, the most common symptoms of sexually transmitted infections?
Systems or symptoms? Would
symptoms.
You like to, yeah,
yes,
symptoms. The symptoms that we would see commonly is they can differ from between men and women. And majority of them could be asymptomatic. One of the things that we have to keep in mind is most of the sexually transmitted infections can be without symptoms, or we may not notice the symptoms until complications arise in us. But if they do develop symptoms, so in women they can get a vaginal discharge with lower abdominal pain. If they are infected with infections like gonorrhea or chlamydia, they can have vaginal discharge with itching of the genital region if they have something like candidiasis, or they can have vaginal discharge with an offensive smell if they are infected with something like trichomoniasis. On the other hand, men can have a discharge coming from the urethra or pain in their testes if they are infected with gonorrhea or chlamydia. And both men and women have genital ulcers if they get infected with infections like herpes or syphilis, and they can have genital warts if they are infected with human papilloma virus. So these are the common symptoms that we would see if they develop symptoms, but we have to always keep in mind most can be asymptomatic.
I think that's a very good point, Doctor. We have to emphasize to the general public that most of the STDs, most common symptoms of STDs can be asymptomatic, and you have to be vigilant in order to actually identify or diagnose yourselves with having an STD. So my next question to you would be, what actually puts an individual in risk of when having an STD in the current context in the society?
Yeah. What puts a person at risk of acquiring a STI is having unprotected sex with someone who is less known to them. So when I mean unprotected sex, is having sex without the protection of a condom, and also even close intimate contact will lead someone to acquire infections like herpes, human papilloma virus, which gives rise to genital warts. So unprotected sex gives rise to the acquisition of sexually transmitted infections. Also, people who inject drugs, if they do not use sterile equipment, if they share their injecting equipment, then they are at risk of acquiring infections like syphilis, hepatitis B and C, and HIV through their injecting practices. So these are the most common ways of acquiring sexually transmitted infections. And also, if a pregnant woman is infected, then there is a risk of mother to child transmission.
And well, talking about the complications, because IMED is usually about talking about the diseases and the complications that goes along with it. So if we could actually talk about the complications that we can have having an STD.
Yeah, the complications arise because, as I told you at the beginning, most of the symptoms, they don't get symptoms, so they would not know that they are having an infection, and therefore they will just harbor the infection within their genitalia at first, and then these infections may ascend to their reproductive tract. So initially the infection will be infecting their genital system, and then it would ascend to the reproductive tract and inflame the reproductive system. So if in a female, if the reproductive tract get involved, inflamed, she would get something called the pelvic inflammatory disease, and later on this would give rise to ectopic pregnancies in the female, or she can even get infertile because of this. And in the male, if this ascends, the infection ascends, they can get something called inflammation of their testes, epididymis, and the prostate, and they can get epididymocystis or prostatitis, and later on again infertility in the male. So these are some of the common things due to ascending of the infection to the reproductive tract. Then again, these infections can spread via the blood and the lymphatic system, and then it can disseminate to the rest of the organs in the body also. Like syphilis is one of the infections that can spread to other systems of our body. So your lymphatic system, your kidneys, your liver, your nervous system, any of those organs can get affected. And sometimes you can also get cancer. So these are the complications that we would see. So hepatitis B initially infects our liver, but if it goes on for a long time, if we do not cure it, then it will affect the liver, and it will go on to become a cancer. And some of the variants of human papilloma virus, if infected, will give rise to carcinoma of the cervix in the woman, or oropharyngeal cancers or anal cancers in people.
So I think when you say the word cancer, people might trigger themselves or get feared or frightened. So we have to alleviate that said misconception that cancer is not a deadly. It is a deadly disease, but you have not don't have the reason to actually be scared without any reason. So it's not about cancer today, but it's about STDs. But we were talking about the complications alongside STDs, which could lead to cancer.
Yes. If I may interrupt, so there is two diseases that lead to cancer in the STDs. One is hepatitis B, one is human papilloma virus, and luckily enough we have developed vaccines for both of them. So we have vaccination, and in our EPI program we vaccinate newborns for hepatitis B, and also we vaccinate young girls at the age of 12 in the school vaccine program for human papilloma virus since 2017. So it's preventable conditions now in Sri Lanka, and the people who have missed the vaccination for human papilloma virus, since we started it in 2017, they can get on to the PAP screening program after the age of 35 years and identify whether they have had HPV infection in them and see whether they are at risk of getting the cancer.
I think that's very good to hear. That's a very good thing to hear. And I was about to ask you about the treatments available in general and the resources available in the local sector, in the medical sector. What are the treatments
for sexually transmitted infections? Yeah, so sexually transmitted infections can be caused by bacteria, can be caused by viruses, can be caused by protozoans, can be caused by fungi. So most of the bacterial infections are curable, and we do have treatment for those bacterial STIs. And we do have treatment for viral infections as well. Only thing is they are not curable, but they are controllable. Still, whatever the sexually transmitted infection may be, we do have treatment for all of them in Sri Lanka. And we do have our national guidelines for the management of sexually transmitted infections and HIV in Sri Lanka. And these guidelines are developed by the National STD AIDS Control Program, and they are regularly updated, keeping in par with the international guidelines. So we will manage these patients according to the national guidelines set by the National STD AIDS Control Program, and we have 42 clinics spread out within the 25 districts in Sri Lanka, usually under a consultant venereologist. And if anybody comes to these sexual health clinics, they can get themselves tested and screened for sexually transmitted infections. As we said, most of them may not be having symptoms, but they can still get themselves screened, and then if they are diagnosed to have an infection, then they can be treated for those, and free of charge.
Free of charge.
Yes, it
and doctor, when you say you're going along with the international guidelines, do you refer to the WHO or the World Health Organization?
Yes, mainly as a low and middle income country, we do refer the WHO guidelines, but we also look into what is called the BASH, which is the British Sexual Health Association for developing guidelines, and also the CDC. So we do take inputs from those guidelines, but we try to keep what the WHO recommends for countries like ours.
I think the guidelines could change because the same environmental factors, the same health factors, the facilities available, I think those differ from country to country. So we have to adjust the guidelines when it comes to Sri Lanka as well. And now moving on with the preventive steps that could be taken, for contracting STIs, to reduce contracting STIs. What are the preventive steps that the general public could take?
Yes, how can I prevent getting an STI? So mainly there are three things. We call it A, B, C. So A is the good old abstinence. So if you don't want to get a sexually transmitted diseases, one thing is to abstain until you decide to have a mutually faithful partner to have sex with. So you abstain until you decide to have a sexual partner, and then till then you don't have sex, so then you don't get a sexually transmitted infection. Second one is B, that is be mutually faithful. So being faithful yourself is not enough. You have to be mutually faithful. That is, both you and your partner has to be mutually faithful. So to do that, what I would recommend is, when you decide to have sex with someone, you have to initially go and get yourself screened and see that both of you do not have a sexually transmitted disease. Once you do that, it is best that you then go together and screen yourself periodically, and thereby you know that you don't have any sexually transmitted infections and you're mutually faithful to each other. So, the third one is using condoms. If you cannot adhere to A or B, the third one is the correct and consistent use of condoms. Every time you have a partner, then you have to use the condom correctly and consistently, and that is very important, the word correct and consistent use. Those things will prevent you acquiring a sexually transmitted infection onto you. Then there is a fourth one, a new one, a D, which is if you have a sexually transmitted in yourself, the other thing is to get yourself tested and treated, because if you do that, you will prevent complications in yourself and you will prevent further transmission of the disease to another person. So those four things are very important.
When taking preventive steps to actually reduce the risk of getting an STI. I think that was an all-round answer to the general public as well. You can remember them by the acronyms ABCD as well. So now I'm about to step into a very important question in this conversation, which has been quite controversial in the past and in the present as well. Which is sexual education to the younger generation, because there has been lots and lots of controversy regarding this topic. What is your take? What should be included in the sexual education? What's your take on that?
Yeah, sexual health is not merely the absence of a disease. So sexual health is the general well-being of a person. It is a respectful approach to someone's sexuality, their sexual relationship, underscoring the fact that their sexual relationships should be safe, without violation, without discrimination, without coercion, and it should be pleasurable for these individuals. So sexually transmitted infections are just one element of sexual health. So what I see in our sexual health education, the so-called sexual health education in the school curriculum, is we teach them about sexually transmitted infections, what causes it, what are the symptoms, and we ask them some questions in the O levels. So what are the symptoms of gonorrhea, what causes it, and things like that. But we do not empower our youth as to how they can make informed choices regarding their sexuality, how they could prevent acquisition of a sexually transmitted infection or prevent an unwanted pregnancy. So unless we do that, they would turn towards less trusted sources of information for sexual health, and that would misguide them, and that would end up in a lot of problems as a practicing doctor, which I am seeing right now. So I think age appropriate sexual health education throughout their school education should be given to them to prevent not only to have a good sexual health education, to prevent violence, to say no when harassment occurs. It can be in school, it can be in workplace. They don't know how to handle harassment, do they? So we have to give age appropriate sexual health education, so that not only they prevent STIs, but they know how to handle their sexuality. And also we should give, as healthcare providers, good messages through a very good communication strategy.
I think the sexual education is a big part, and I think you had an all-round answer where we could come to a better, conclusion where younger generation should have a balanced, not only teaching about STDs is going to solve the problem, having an all-round, thinking about the practical situation can help a lot, right? So now I am about to end. We have come towards the latter part of the program. So what is your message to the general public out there about getting STIs the topic of STIs in general?
Well, I would like them to be more aware of sexually transmitted infections, be more aware of their sexual health, and be more empowered about it. And I would like to tell them that there are sexual health clinics all over the country which is providing free services for testing as well as treating. So they can come to these clinics and they can get these services maintaining their privacy and confidentiality. I have to underline and emphasize the fact that we maintain privacy and confidentiality of all people who come to our clinics. So when they get themselves tested, when they get treated, their privacy and confidentiality will never be breached, and they can come and get treated even if they don't have symptoms. If they think that they have been exposed to a sexually transmitted infection, or they may have been at risk of a sexually transmitted disease, then they should come and get themselves tested, because unknown to them they may be getting complications, or they may be transmitting it to their loved one or to their child. So it is best that they get themselves tested and treated today.
I think that part where you said confidentiality and the privacy of the patient is something which the general public is, I think, in my perspective, they are a lot worried about that, the confidentiality. They can't face their relatives, the general public, the society in general. So I think that's a good message that you could give to the public, where the confidentiality or anything of breaching their own personal privacy would not be breached. So I think that was an all-round answer as well. So with that, we have to end today's show, Doctor, and a big thank you goes out to you for being here amidst your busy schedule. And yes, we did have with us Dr. Lasanthi Sirivardhan. She is a consultant venereologist at the Sexual Health Clinic in Kalutara. Again, thank you so much, Doctor, for being here with us.
Thank you for inviting me. Thank you.
And with that, we end today's segment of iMed. Thank you so much for joining in, and do join in next week as well. So with that being said, I'm saying bye. Have a very good week. Have a pleasant day as well.